Welcome to the study session where we are breaking down the BCBA 6th edition test content outline. Today we are diving into task B.13, Stimulus Discrimination.
Still in Domain B, 14% of the exam. B.13 builds directly on B.12. Once you understand stimulus control, stimulus discrimination is the behavioral outcome you are trying to produce. These two topics are tested together constantly, so mastering both together is the smart move.
Stimulus discrimination occurs when an organism responds differently in the presence of two or more stimuli. Specifically, responding occurs in the presence of the SD and does not occur, or occurs at a much lower rate, in the presence of the S delta.
Here is the analogy I always use. A dog that sits when you say sit but does not sit when you say down, that dog has learned a discrimination. The word sit is the SD. The word down is the S delta for sitting. Different stimuli evoke different responses. That is stimulus discrimination.
Discrimination develops through differential reinforcement. You reinforce the response in the presence of the SD and withhold reinforcement in the presence of the S delta. Over time the response rate in the presence of the SD increases and the rate in the presence of the S delta decreases.
Here is where the exam will try to trip you up. Students confuse stimulus discrimination with stimulus generalization. Discrimination means responding differently across stimuli. It is about precision and specificity. Generalization means responding similarly across stimuli. They are opposite processes. Know that distinction cold.
Let's connect this to verbal behavior. Teaching a child to label a dog as dog and a cat as cat is discrimination training. The child must respond differently to two different nonverbal stimuli. If they call every four-legged animal dog, discrimination has not been established. That is overgeneralization.
And for intraverbals, when you ask what do you do when you are tired, the child should say sleep, not eat. Discriminating between different verbal antecedents and producing the appropriate verbal response is intraverbal discrimination. Weak intraverbal training means weak discrimination.
Clinical discrimination training runs on discrete trial teaching. Each trial presents the SD and an S delta, reinforces correct responding, and uses a correction procedure for errors. Your trial structure, your reinforcement schedule, and your SD to S delta ratio all determine how quickly discrimination is established.
Here is a nuance worth knowing. Errorless learning procedures establish discrimination with minimal errors by starting with prompts and fading them systematically. This reduces the amount of responding in the presence of the S delta, which can strengthen discrimination faster and reduce frustration.
Conditional discrimination is a more complex version the exam tests. In a conditional discrimination, the correct response depends on a third stimulus, the sample. Match-to-sample tasks are the classic example. The correct choice depends on which sample was presented. That is a conditional relationship, not just a simple SDS delta relationship.
Ethics and task list connect here too. Teaching discrimination is under G.6. If your client has not developed discrimination, responding the same way regardless of the antecedent, your intervention is not working and you have an obligation under the task list to modify your approach and document the change.
Functional analysis depends on discrimination too. A behavior that only occurs in the attention condition discriminates that condition from others. That discrimination tells you the function. If the behavior occurs across all conditions with no discrimination, your functional analysis results are inconclusive and you need to investigate further.
And here is the exam summary. Stimulus discrimination equals differential responding across stimuli. It requires differential reinforcement to develop. It is the opposite of generalization. Conditional discrimination adds a sample stimulus that determines the correct response. Master those distinctions and you are ready for any B.13 question.
Let's add one more layer on conditional discrimination because it shows up more on the exam than people expect. In a simple discrimination, one SD evokes the response. In a conditional discrimination, two stimuli together determine the correct response. The matching to sample task is the most common example. What is correct depends on the sample shown.
Conditional discriminations are the foundation of emergent relations and equivalence. Once a learner has a history of conditional discrimination training, they may show derived relations, responding correctly to stimulus combinations they were never directly trained on. That connects B.13 to B.21 on the task list. The exam loves those crossovers.
Reinforcement delivery precision matters a lot in discrimination training. If you accidentally reinforce responding in the presence of the S delta, you blur the discrimination. Clean trial structure, clear SD, consistent reinforcement for correct, consistent no reinforcement for errors, is what builds sharp discrimination over time.
And always monitor your inter-trial interval and your SD delivery consistency. Sloppy SD presentation is one of the most common reasons discrimination does not establish cleanly. Your treatment integrity data should include whether the SD was presented correctly on every trial. That is task list C.12 and H.6 in action.
For more practice questions, visit www.bcbamockexam.com.
See ya.
Bye.